When looking to treat anterior knee pain with one of our percussion massagers, we want to be able to focus on the area where the pain is at, the muscles above and below it, and then as well as following that nerve distribution or that electrically wire system, we want to be able to follow that back up to where it came from. So using a massage gun, typically what I'll focus on when I'm treating anterior knee pain is a couple of key spots. When you look right above the kneecap, the tendon comes together, and then there's a little muscle right above the knee that kind of helps tension that tendon and kind of control the kneecap inside of the bundle. So I really like starting right above the kneecap, and of course the kneecap is that little round bone in the middle that you can wiggle back and forth. You're going to come right above that bone, maybe a thumb width or so above the bone, and then right in that muscular area you'll find just kind of a soft spot, and that's where you want to work. The speed setting on the gun, I always, there's the different brands, they all have different speeds and different controls. Start lighter than you think you need, and then if you want to build up intensity, certainly you can. With all of these treatments, we want to have our intensity level about a 5 out of 10 or a 50% intensity. So 10 meaning, hey, we're going to a hospital. 3, 4, 5, somewhere in that intensity range is going to be enough to create some change without irritating the tissue or irritating the area. So we're going to come right above that kneecap, about a thumb width above. A lot of times I'll even use my thumb to block the kneecap to make sure I don't, kind of bounce the massager off of the bone. But I'll just kind of protect that area, and I'm going to press straight down right above the kneecap. Your pressure, again, you're looking for that 5 out of 10 intensity, so you can apply as much pressure as you need. And if it's a bothersome area, sometimes you'll even feel a little bit of radiation kind of up over top of the kneecap itself. When you find that tender spot, we're going to try to hold it for 30 seconds to a minute. Okay, so that's going to be spot number 1. From there, you're going to move to the inside. And when we look at the inside of the quad, if you flex the muscle, you'll see that muscle belly, which we call the VMO. So we can kind of hit the edges where that muscle belly goes into the patellar tendon. We can catch it here. And you'll also notice that we have this red line. This red line is representing a nerve that we call the saphenous nerve. The saphenous nerve is going to be a sensory nerve that goes to the inside of the leg, all the way down actually to the inside of the foot, and all the way back up. So anything that's happening on the surface or a feeling of sensation or touch or even pain, anything that's happening through this distribution is going to travel through this nerve pathway or this wire signal back up to the brain. So when we get to this inside edge, it allows me to work both that muscular distribution as well as that saphenous nerve type piece. So I'm just going to come around to that inside edge, and I'm going to try to push right on the inside of that muscle belly. So if I flex and I come right up the inside edge of that, and then relax it, and I'm just going to try to roll right off the corner of that muscle, and I can work all the way up that inside edge. Same as what we talked about on the top of the knee, 30 seconds to a minute, and just kind of make your way up and through. Following that muscle belly all the way up as high as you'd like. We can also follow it behind the knee. Now the difficulty or the challenge in following it in the knee is you'll see if I get that thing over top of the bone, it's going to bounce. So what we're going to do instead is we're going to go right below the bone. Use your thumb to kind of follow the bone down, and it rolls, and you can kind of feel a ledge there. Leave your thumb right on that ledge, and then put the massager below your thumb. You don't want to smack it right on top of your thumb, that hurts. Right? So we're going to put it right on the bone, stay below it, and press right behind that ledge of the tibia. And then from there, we can work right along that edge, and we can actually follow this one all the way down the knee as well. Okay. Same idea, when you find a tender spot, spend about 30 seconds there until you feel that tenderness kind of dissipate a little bit. For working in this area right around the knee and around the bone, we're going to be better off using either our cups or instrument-assisted massage tools, which you can find in a different series. Okay. And then the last piece I like to treat is of course on the outside edge. Now on the outside edge we got a couple of things happening. We have the big muscles of the quad, the rectus femoris and the vastus lateralis. They're coming down, inserting into that tendon. We also have a big, thick connective tissue sheet called our IT band that's running down this outside edge and is going to connect on the outside. So a lot of times if you're getting pain on the edges of that kneecap, this outside edge can be quite tender as well. Same as we did on the inside of the quad, we're just going to go to the outside. Now I'm going to follow that ledge on the outside edge, and I'm going to work down and around, heading back towards the knee. Okay? If you find anything tender along the way, stay there for about 30 seconds to a minute. Okay? And we're just going to work each of those corners all the way back up and around, trying to stay in that groove between the quadricep muscle and some of the tightness of the IT band. By working that series, it allows us to hit the middle, inside, and outside of the quadricep muscle. It also allows us to get into that nerve distribution that is going to supply the anterior knee, and it should be able to provide a little bit of relaxation and almost desensitize or calm the area down before using some of our other tool or treatment techniques.